Literacy is fundamental to health outcomes. So when we're looking at how people are managing with their chronic diseases, for example, or if we're looking at hospitalization rate or people coming to the ER, then we look at the role of literacy in that experience. So it's something that has to be addressed by the health system.
I think that it's really important for us to realize that we all are impacted by health literacy, and that it isn't a certain segment of the population, that it's your neighbor, it's your parents, it's the kids in the schools, it's the people in your community. And so health literacy can impact our health overall, and so that can impact our society and our overall economic opportunities in the future.
Even really intelligent people, well-educated people, in the stress of a medical situation, when you're ill or you're totally out of your usual field, you can be health illiterate. Healthcare professionals, I think, too often forget that they're in their own little world, and that other people might not be able to communicate the same way they do.
It's just the ability for people to navigate information, find information, and use tools to get the information they need to be in control of their own health and to benefit their own health.
I think that information is power, and I think that informed decision making is what health is all about.
Right now in the province, we're in a time and a place where health literacy has emerged as an area that we need to be paying attention to for a number of reasons. Certainly our healthcare budget is increasing, and if you look at projections over the next 10 years, it will continue to increase exponentially.
I think of health literacy as a determinant of health. And if we do not address the social and economic determinants of health and improve the health system, the health budget is going to take more than 50%. It's already taking 50% of the provincial budget, and it will increase and increase so that we will have less money for education, less money for housing, less money for roads. And I don't think that's what the population wants to see.
Literacy may have a direct impact in terms of people's ability to read instructions, to read prescriptions, prescription bottles and things like that. So that can have a direct impact on one's health. It also can affect one's health indirectly, because your literacy levels and your literacy skills will determine the extent to which you can get a good job, have a reasonable income, be able to work in a safe environment.
A mother who has difficulty reading a label on a medication and calculating the dosage to give her child, because it should be based on weight, obviously has problems, so it's key.
Literacy is embedded in everything, either low skills or high skills. It just affects all aspects of our life. Either we look at it from a cost-benefit perspective, or we look at it from a social perspective. It makes good sense to think about literacy and how we can use literacy as a solution rather than as a problem, and to embed it in all the sectors and all the aspects of work and life.
So I think a couple of things are very helpful to improve communication between patient and doctor. For example, if you're not feeling confident as a patient to go and see your family doctor, having a friend come with you, a buddy or family member, very helpful, because sometimes you're nervous and your friend can remind you what the doctor said after the meeting. For the doctor, I think a general communication principle, which is to feed back and ask the patient to feedback, what have you heard from me today?
We're accustomed to respecting people's privacy so much that there's nobody there to explain to them what's going on. When they come out and I say, what did the doctor say? And they say, I'm not really sure. And then I ask the doctor, what did you say? Well, that's confidential, I can't really tell you.
There's responsibility on both sides of the relationship. On the professional side, in this case the doctors, they have, I think, a full responsibility. They're the ones with the knowledge to be able to communicate in such a way that anybody who comes walking through their door can understand. On the learner side or the patient side, we have just as much responsibility to try to inform us. So if we're scared, we should bring somebody with us. If we don't understand, we need to be able to say, I don't understand.
Another approach that we've started to use is getting patients together in groups so that they can actually they can hear information from health providers, and some providers can take more time with them, but they actually have discussions with their peers and amongst their peers. And people often, perhaps, with similar health literacy challenges as they would have.
For example, pharmaceutical companies produce, the labels are written in very small print and in difficult language. So the reading ability of most people is around between grade 4 and 6. So requiring that all health information is at that level would help.
Our idea was that we needed to change how the people approach the situation more than really change what happened in the doctor's visit. And so one of the things that we thought of was bringing a translator.
I have a patient that has been in my practice for years, so I spent some time with her one day and I sat down and I actually asked her which medication she thought was for a certain condition. And then I read out her medications and asked her what she thought that particular medication was for. And I was amazed to find out that, in fact, the vast majority of her medications, she was confused about why she was taking them. And I spent that time writing out the medications in plain language, explaining why she was taking them and for what condition, and why each one was essential. And since that time, she has not asked me why she is taking so many medications, and she seems to be much more comfortable with them.
I think that one thing that can be done from the health leader perspective is to really embed an understanding of literacy in training of healthcare practitioners. We work at Douglas, and we've had instances where we went and talked to classes of nurses, and they had never heard the concept of health literacy. They never thought that the patients that they would encounter would have a literacy challenge, or that whatever they said wouldn't be understood the way that they thought it was being said.
One thing that's helpful is for the patient to write down, or have somebody else write down the questions that they would like answered when they go to see their doctor.
You have to look at the idea of respect and building trust, and the idea of kindness, just to create an atmosphere of trust. Kindness creates an environment where trust can bloom and flourish.
I think if we're listening to patients and really hearing them, if we're listening to doctors and really hearing them, to nurses, pharmacists, understanding their experiences and improving those experiences, taking away the barriers. My greatest job in the Ministry of Health Services is removing barriers. That's what we need to focus on.